Hi Zoe, I'm Nurse B. Nice to meet you.
Nice to meet you.
I'm going to be performing a cranial nerve medical exam on you today, checking all of the nerves that are functioning in your face, as well as just doing some other general wellness checkup things, okay? So I see here in your file that you just had hit your head recently and you felt a little bit dizzy afterwards and wanted to get checked out, okay, right? Right. And how long ago was that?
It was about a week ago.
About a week ago. And did you lose consciousness at all?
I did not.
Okay, good. Any breakage of the skin, any wounds, blood, that kind of thing?
No.
No, okay. So I'll just be feeling for some lumps, bumps. And just point to where you hit your head when you fell, if you remember, sort of the back there.
Back here, yeah.
Okay, so back right. Any other symptoms that have come up besides just a little bit of that dizziness and headache?
No, not really.
Okay, so dizziness, headache. And has it been getting worse or better or staying the same?
The headaches have been getting slightly worse.
Headache slightly worse. Dizziness
Dizziness slightly better.
slightly better. Okay. Right. Any other health things I should know about? Any other health histories, major surgeries, events, things like that? And are you currently taking any medications that could cause dizziness or headaches?
No.
Okay. Any other changes in sleeping?
I have been having a little bit of a difficulty sleeping.
Sleeping is harder. Okay, and that's since the incident a week ago?
Yeah.
Right, now I'm just going to make my way just down through your cranial nerves. So any vision changes, any blurriness, any double vision?
No.
No, okay. And what about with your smell? Any changes to your olfactory function or anything like that? No. Any changes in your taste or weird taste through your mouth? Okay, good. And any changes to your hearing? Pain in the ears? Okay. No ringing or anything like that? And then what about the rest of the body? Any physical aches and pain anywhere else? Did you hit yourself anywhere else that you fell?
No, I mean, when I fell, I just kind of hit my elbow a little bit,
Okay.
but that's been fine.
That's been okay.
Yeah.
All right. And any other weakness or tingling, numbness?
No.
All right. So I think I have a good basis here to get started. I do want to do a thorough check because you did have that impact. It's important for us to make sure that all of the neurological functions are there. Starting out with just asking you a few questions. So can you tell me where we are right now?
We're at the doctor's office.
Okay, and about what time of day is it?
It's about 2 o'clock.
Okay, perfect. What is the weather like outside?
It's sunny.
And what about the temperature? Is it cold, warm?
Warm.
Okay, so you know exactly where you are, what time of day it is. Do you remember my name?
Dr. B.
Perfect. And what about, what did you have for breakfast this morning?
I had eggs.
Eggs, okay. So your short-term memory is pretty good. What was your favorite subject in school growing up?
Theater.
All right, so your long-term memory is there as well. I'm going to give you 3 words to remember. I'm going to do a couple of other tests and then ask you again. So I'll go ahead and point to just a few things in the room so it'll be easy to remember. Table, okay, shirt, and painting, okay? Can you repeat those words?
Table, shirt, painting.
Okay, good. And I liked that you also looked for those visual markers because that shows that you're using that brain functioning to reason that out. I'm going to have you do a little bit of math now. So if you have 100, can you minus 7 from that?
93.
Okay, minus 5 from that.
88.
Perfect. And 6 from that.
82.
Okay, very good. If I say the phrase, save your money for a rainy day, what does that mean to you?
Saving your money for an emergency.
Okay, very good. What were those 3 words I asked you to remember?
Table, shirt, painting.
Perfect. So all the neurological functioning in that sense is intact, and I'll go ahead and start the physical examination now. So I want to start out with your eyes. I'm going to shine a bit of a light in them. And I'm just checking functionality, so just stare straight right over there for me, please. And you're gonna have a bright light, it's gonna be a little uncomfortable, I'm sorry. Good. Checking the consensual light now. And that does react perfectly good. I want you to stare right at this light here and just follow it. First of all, can you see this clearly, no double vision?
Mm-hmm.
I follow it everywhere it goes, just moving your eyes, not your head. Any double vision?
Mm-mm.
Good, no jumping of the eyes. I want you to follow it out and then back in. Okay, very good. I'm going to be making a couple of wiggles with my fingers. I want you to stare right at me and just look at my nose and tell me when you see my fingers wiggling into your point of view.
No. No.
Good.
No. No.
Okay. I'm going to give you something to cover up one of your eyes. So I just want you to cover one of your eyes with that. I'm going to cover the same one. And again, stare straight at my nose and just tell me when you see my fingers wiggling.
No. 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 No.
Okay, and the other side.
No. 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 No.
Okay, how many fingers do I have up here?
2.
Okay, switch eyes.
3.
Okay. So peripheral is very good, actually, a very strong peripheral. You can hand that back to me. Actually, hold on to it. Let's go ahead and do the Snellen chart. So I just have a Snellen chart right here. I'm going to hold it a couple feet away from you. Can you see this at all?
Mm-hmm.
All right, I'm going to point to a couple letters, and I want you to just read it for me, okay?
L. P. E. D.
Okay, cover one eye. And can you read this line for me?
P. E. C. F. D.
Okay, cover the other eye and read it backwards.
D. F. C. E. P.
Okay, with both eyes uncovered, go ahead and let them blink back. I want you to try this line right here.
D. E. F. P. O. T. E. C.
Very good. And stepping back just a little bit further here, can you tell me what this number is?
10.
Right. So that's all fine. I'm going to do a little color test. So first I'll show you several colors and I want you to just tell me what they are. So what color does that look like to you?
Blue. Pink. Orange. Yellow.
Okay. And now I've got a book here. I want you to tell me what number you see there.
5. 7.
Okay. And then I'm going to have you trace with your finger. And where's that pointer? So I just want you to hold this. I want you to point to a bright green dot. Very good. How about a brown dot? Okay, how about a red dot? And a sort of yellow mustardy colored dot. All right, so you're able to differentiate all those different colors. Do you see a number here?
I do not.
Okay, very good. You shouldn't. And then what do you see here?
42.
All right, thank you so much. So the eyes look really good. I'm just going to take a really close look. So again, stare straight into the distance. I am going to get close to you here. Okay, red reflex is intact. Same thing on this side. Okay, and that all looks fine and normal to me. I'm going to have you take your finger, touch your nose, okay, and touch my finger. Everywhere it goes. Very good. Just watching the eye movements as well. Good. That's fine. You're very quick at that, which is wonderful. I'm going to have you lift your eyes nice and wide and look that way. Look this way. Up. Down. Just going to look. Open them for me, please. Good. Can you puff your cheeks out for me and hold them? Push your chin against my hand. Push back to the right, to the left, and just turn your head like that. There you go. This side. Okay. And push forward. Shrug your shoulders for me. Just doing a little bit of strength while we're at it. Next, I'm going to take a look at your nose. So I'm going to just have you said no changes in smell or anything, right? Mm-hmm. Maybe tilt back slightly here. And that looks fine, nice and clear, no deviation of the septum. I'm going to give you a few things to smell. I just have a few different smells here, so close your eyes for me. I'm going to open them up. And just take a big smell of this one with both open. And it could be like a sort of what it generally reminds you of.
Lavender.
That's exactly right. So go ahead and close one nostril, breathe in and out from the other one. Checking for occlusion. And then keep that covered and tell me, what do you smell here?
Citrus.
Yep, lemon. Perfect. Let's do the same thing on the other side. Close that other nose, breathe in and out. And I'm going to give you one last scent here.
I'm not sure what that one is.
What does it remind you of?
One more time.
Yep.
Oh, peppermint.
That's exactly right. Yeah, sometimes it can just take a second to jog our memories. All right. So if we open up and say ah, you can open your eyes. Ah, checking for the uvula, and it rises. Just gonna feel around the jaw here. Can you open and close for me? Again. Okay, that's all fine. No changes in your taste, correct? Okay. I'm gonna have you swallow for me. Good. And just checking the neck. I'm gonna feel the lymph nodes now, so you're gonna feel me working my way around here. Any pain when I do this? Okay, coming around the back. Shrug your shoulders for me a little. Okay, and relax. I'm just gonna get the ones here. Just a reflex in your jaw. Just let it hang for me, please. Good. All right, lastly is your ears. I'm just going to take a peek in here. Those look really clear. Just a little bit of earwax, which is very normal. No redness, no discharge. Any pain here? Okay, what about on this side?
No.
Okay. I'm going to be whispering something in your ear. I just want you to close your other one. So close that ear. I'll whisper over here. Have you repeat after me, okay? C-R-T.
C-R-T.
C-R-T, very good. And same thing on this side. Close your other ear. B-L-A.
B-L-A.
Okay. So you're able to hear that just fine. I'm going to hit this tuning fork, place it right in the middle of your head. Tell me if you hear me left, right, or equally.
I feel like I feel it a little more on the left side.
On the left side, okay. I'll try it one more time.
more equal now.
More equal, okay. So a little bit more sensitivity on the left side than the right. That could also be if there is some swelling from that injury. There could just be a little swelling around the ear as well. So let's try it individually. So I'm gonna hit this, place it on the back of your ear. Tell me when it goes away. You hear that?
Mm-hmm.
Do you still hear that right there?
Yes, yeah.
All right, so that's functioning normally. Same thing on this side. Tell me when it goes away.
No.
And you still hear that right there?
Yes.
Okay. So that also is not too concerning. There's a little bit of a hearing deficit. Let me just close your eyes. You hear this? Tell me when it goes away.
No.
Okay, how about this side?
No.
Okay, definitely a little more acuity on that left side. So could be some swelling blocking the ear there. I didn't see anything in the ear itself, so I'm almost wondering if it's just because you have a little bit of a headache on that side. While I have these out, I'm going to test some sensation, starting out with just a really light touch. So close your eyes and just say yes when you feel it.
Yes. 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 Yes.
Okay, does that feel the same all the way around?
Yes.
Here and here,
Yeah.
here and there.
Maybe slightly more sensitive on this side.
You can feel it better on this
A
side?
little bit, but
Okay.
it's mostly-
Mildly, okay. I'm going to do the same thing with a sharper tool. This is quite sharp, but I'm not going to be breaking the skin. But I want you to tell me if it feels the same sharpness side to side. So does that feel the same as that?
Yes.
Okay, good. This and that.
Yes. Yeah.
Does it feel as sharp all the way down the face?
Yeah.
Here, here, and here.
Yes.
Here, here, and here.
Yeah.
Okay. So that's fine, I think, sensory-wise. What does that feel like to you?
Cold.
There too? Same?
Yes. Yeah. Yeah.
All the same?
Yes. And all cold.
And do you feel this here?
Mm-hmm.
Tell me when it goes away.
Now.
Okay. Try that again. Just tell me when the vibration stops.
Now.
Very good. How about right here? Feel that? Not as much?
Not as much. Yes, I feel that. And it's done.
Good. All right, so a couple of disparities there in the sensory exam. I would say if don't feel better in a couple of weeks, we can do a really thorough sensory exam. But for the most part, you were able to feel everything, differentiate between sharp and dull and that kind of thing. So I'm not too concerned. I'm going to move down to do some strength testing now. So I want you to put your arms up like this and down like that. And then just don't let me push me back here, and like that, and push me away. Put your wrists out and lock them up. Don't let me pull them down. So
Oh,
keep
got
them
it.
up like that. And that way, and down. And don't let me pull them up. Can you go side to side for me? Just with it like this. Well, like that. Yeah.
Yeah.
Yep. Any weakness or numbness? Okay. I want you to just put your fingers out like that. Don't let me push them in. Nice and strong. Very good. You can relax. I'm going to do that same bit of sensory just down the arms and just be testing a few of the parts of the arm here that have different nerve relations. So say yes when you feel it. Keep those eyes closed.
Yes. 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 Yes.
Okay. What does this feel like to you?
Sharp.
Okay. And how about here?
Yes. Also sharp.
What does that feel like?
Soft. Sharp. Soft. Sharp. 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 Soft.
Okay. Does this feel as sharp all the way down
Yes.
from here?
Yes.
Okay. What does that feel like?
Cold.
Cold, same thing?
Yeah, cold.
Same thing?
Cold.
Okay. I'm going to take your hand. I'm going to be lifting the finger joint up and down like that, okay? Just tell me if you feel it down or up.
Down. Down. Up.
Okay, try this one.
Down. Up. Down.
Okay, so the other hand.
Down. Down. Down.
Good.
Up. Down. Down.
All right. I'm going to put something in your hand, so keep your eyes closed, and I want you to tell me what it feels like. Okay. What does this feel like? Open the hand, feel around.
Feels like a spray bottle.
Very good. And on the other side, I'm going to give you something else to hold. What does that feel like?
A cotton pad.
All right, good. So you're able to differentiate. I'm going to be drawing something in your hand now. So I'll start with this side, and it's going to just be a number. So tell me what number this is.
1.
Okay, and what about this?
7.
Add those together for me.
8.
Okay, and I'll do this side now.
3. 3.
Good. And what are those together?
6.
Awesome. So really all your neurological functions are intact. I want to finalize with just some reflexes and some, just to do your vital signs, okay? So I'm going to take your arm here. Just try and relax as much as possible. Just give me all the weight of your arm. There you go. There you go. Very good. And look away. Don't pay attention. Keep your eyes open, but stare ahead.
Oh, okay.
Okay. And don't pay attention. All right. Same thing on this side. Reflexes here. Up like that. Again, give me all your weight. There you go. Very good. Very brisk. And stare straight ahead again for me. Okay. And I'll just have you make sure that your legs are nice and relaxed. I'm going to do the patella. And just relax. There you go. So I know you mentioned in your chart that you had pretty brisk reflexes. I'm going to do the ankles too. And just like that. There you go. Okay. So no problem with the reflexes. Let's just take your temperature. And I'm going to feel some pulses and we'll be all set. 98.4, that's normal. Feeling a couple pulses here on the neck. Good. The arms. All right, so I'm just going to get my chart here, but everything feels relatively normal. However, there were just a few inconsistencies with that hearing and that sensation that just causes a little bit of concern to me that I want you to go ahead and get a scan. So I'm going to write you a prescription for that. But again, it's been a week. The headache's getting worse. It can take several weeks, up to several months from a headache injury to really recover from that. So once, if the scan comes back clear, I think it's just rest and anti-inflammatory medication. Any other concerns with me for me today?
No.
All right. Well, thank you so much for coming in, Zoe, and I hope you feel better soon.
Thank you.